Minister of Education, Dr. Maruf Tunji Alausa, kicked off today by overseeing the 2025-2026 WAEC Secondary School examination at Start Right Secondary School. Later, he inaugurated the Implementation and Monitoring Committee for Medical Simulation Centers, underscoring the ministry's commitment to enhancing medical education and ensuring the integrity of national examinations. Welcome to Equal Dwelling TV. My name is Comfort Olaika. Stay tuned for more reports.
The Minister of Education, Dr. Maruf Tunji Alausa, has called for Nigeria's transformation into a hub of medical excellence. During the inauguration of the Implementation and Monitoring Committee for TETFUND Medical Simulation Centers in Abuja, Dr. Alausa highlighted the crucial role of medical simulation centers in enhancing patient safety, upskilling healthcare workers, and introducing telemedicine.
I always say I don't mind laundering our own dirty linen in public. That's how you can hold yourself accountable and improve yourself. The TETFUND, the way people, any average Nigerian today, you ask before the last several months, what do you know about TETFUND? You say, oh, go there, it's contract, nothing, they don't get anything done. Today, TETFUND is changed. It's clear guidance that Your Excellency, Right Honourable Marcel is providing. Get there, get people to do their work, to serve the country, to get the maximum benefit out of every single naira that is budgeted at TETFUND. And now, we also have the ES that I'm going to talk about now, that has the most institutional knowledge about education, working with the chairman. And that's why we're getting so much output from TETFUND today. Thank you, Your Excellency. We cannot thank you enough for this. Leadership is everything.
The Executive Secretary of Tertiary Education Trust Fund, Sonny Echono, in his response says that medical simulation is a cornerstone of modern medical education, widely adopted in developed countries to train students and professionals.
I think that with regards to what we're doing today, we as the people that have been asked to serve, it's an honor and a privilege to be able to do what we're doing today. And I think that the team that has been put together, they have so much expertise, so much knowledge, and every single one of them is people that I respect significantly, and they will contribute to make sure we can deliver on the mandate. I believe all stakeholders are represented, and we will tap into even people that are not represented to make sure we deliver something that is sustainable, something that will serve the people. The two other points is that medical simulation is a tool that can be used to advance education and training, which you start from the origin, we train people properly. Not just medical doctors, nurses, but healthcare workers can benefit from actually accessing the medical simulation. That's number one. Number two, it actually improves access to care. Because with medical simulation, you can train more people, you can have repetition of hands-on training, even with regards to even just communication, interaction with patients, to improve the satisfaction that our people get from accessing healthcare. So, access to healthcare. Second thing is patient safety. Patient safety is so critical that we don't even capture the top of it. What's the safety record in Nigeria? So, patient safety, because before we used to say do one, teach one, and then see one, teach one, do one. So, I think now we're going to learn, do, and do again, and then you continue to do work on simulation and on patients. That's the way you improve patient safety. And then the quality of care.
Dr. Alausa charged the committee members to work with passion and commitment to finalize the roadmap for implementation. Advancing education and healthcare in a related development, the Minister of Education had earlier commended students, teachers, and administrators of Start Right Secondary School for participating in the computer-based testing pilot for the 2025-2026 WAEC examinations. Dr. Alausa emphasized that the shift of CBT is a bold step towards eliminating exam malpractices and adopting global best practices. With plans to implement CBT for all WAEC and NECO examinations by 2026, the Minister's initiative aims to drive Nigeria's education sector towards excellence and innovation.
School, it's a private school, to see the computer-based exam that WAEC is conducting. This is the SS3 WAEC exam, and I went around, even talked to the students. This CBT exam form is much easier. They like it better. I came here to highlight the importance of CBT in helping to, that will help us to eliminate exam malpractices. I deliberately, the ministry staff asked me to go and see the pen and paper exam. I refused to, because I don't believe in that form of exam again. So, as of today in our country, that form of exam is flawed. It's plagued with a lot of malpractices. And let me commend the head of National Office for WAEC for taking the bull by the horn. I went around, monitored all the screens of each of those 23 students. They were doing objective question in English. It was very seamless. And as I was looking them answer those questions, every single student got their question correctly.
Comfort Olayinka, Ecohot Blog TV.